much do dental implants cost? The most common question people have when considering dental implants is, how much is it going to cost? Unfortunately, that's one of the hardest questions to answer. And while there is a very good reason for that, the uncertainty around the question can sometimes lead to frustration and induce even more anxiety about a procedure that's quite accessible and really can be life-changing. I'll be back in a moment to explain. Hi, I'm Dr. Mauricio Moeller, a third-generation dentist, board-certified prosthodontist, and former University of Michigan School of Dentistry clinical assistant professor. I specialize in complex dental treatments and full arch implant procedures.
The doctor gave me and the Elan team gave me my smile back.
And I founded Elan Implant Center because I believe in the transformative power of a smile. We use the latest technology, advanced surgical techniques, and a full in-house lab to give our patients exceptional care and the confidence that comes with a perfect smile.
I feel pretty, I feel young, and you will go out with perfect, beautiful teeth and smile.
If you're not happy with your smile, give us a call. And be sure to like and subscribe for more content like this. First, you should know that there's no such thing as one-size-fits-all implant pricing. And your overall cost can vary widely depending on your situation, the health of your gums and bone, and the location of the tooth to be replaced all significantly affect the cost. Even the length and the material of an implant can make a huge difference. So when you see a really low price advertised, you should bear in mind that it likely only covers a typical implant and may not include the price of an abutment or a crown. You won't know the cost of any surgical procedure such as bone grafting or cleaning up infections, anesthesia. You will actually want IV sedation, creating a surgical guide, placing the implant itself, or even aftercare and follow-up visits, until scans have been taken and you're actually seen by a doctor. But when you see the price quoted on the high end, that's most likely going to include all of that, and months of ongoing care while you heal. In the end, the final cost generally works out to be roughly the same, regardless of which route you go, in line with the experience and qualifications of the prosthodontist or surgeon who is performing the procedure. All right, we've established that there are many factors affecting the cost of implants, so let's look more closely at each and explore average price ranges in the US. Then we will look at each of the factors influencing those ranges. The simplest and most common is a single implant. In the US, the national average ranges from about $2,000 to as much as $5,000 if you have a healthy mouth. And the tooth the implant replaces is being extracted at the same time. It could be less. An implant-supported bridge replaces several teeth in a row. One implant at each end with a bridge replacing your missing teeth. Now, a national average price range for a typical 3 to 4 unit bridge is from about $4,000 up to $11,000 depending on materials and implant types and locations. Now, implant-supported dentures or overdentures can be an option for people who have already been wearing dentures but are looking for a more comfortable solution that provides the strength and stability to perform more like natural teeth. A national average for these ranges from $7,500 to $13,000 per arch. Now, if you lost most or all of your teeth, full arch or all-on-X implants are the optimal solution. Today, they will most commonly use 6 implants per arch to support a full set of teeth that looks natural and perform as well as natural teeth. In some cases, they can be supported by as few as 4 implants at the lower cost, but without quite as much strength and stability. Nationally, these can run as little as $15,000 per arch for a 4-implant version, to more than $30,000 depending on placement and materials. Again, those ranges are generally guidelines based on national data, and you can check the description for links to the source data. So those are pretty wide ranges, even for ballpark averages. How do we explain that? Let's dig in. First, bone grafting. Bone resorption is a natural process where the body breaks down and absorbs bone tissue. It's common, and when a tooth is removed, that process can accelerate because there's no longer anything anchoring it in place. Basically, the longer a tooth has been missing, the more bone you are likely to lose. If your jawbone isn't thick enough, a bone graft will be required to build up that back up and allow your implant to be set. Depending on the location and severity, it could cost a few $100s or a few thousand, adding to your treatment cost. Second, implant type and design. Most implants are titanium, but some newer materials such as ceramics are often available as well at additional cost. Implant length and type also affect cost, and custom abutments can be more expensive too. Third, implant location. While implants placed in the jawbone are typically cheapest, special types of implants such as zygomatic can be much more expensive. Zygomatic implants are placed in the cheekbone when there isn't enough bone present in the top jaw, and they make it possible for some patients with extensive bone loss to receive implants, when they otherwise would not be able to. That comes at a price though, with each zygomatic implant adding several $1,000s to the overall cost of the procedure. Fourth, surgical expertise and technology. You will pay a little bit more to have your procedure performed by a specialist, such as a board-certified prosthodontist or surgeon, using state-of-the-art technology and imaging. But they can offer a higher degree of precision and likely a better long-term result. Check out my video, Why See an Implant Specialist, link below to learn more. Finally, there's the everything else category. This includes detailed scans, deep IV sedation, difficult extractions, and multiple visits over the course of several months while you heal. To recap, implant pricing depends on a wide range of factors, which ultimately depend entirely on your situation. You can't get an accurate quote without a thorough examination, including detailed scans and an in-person visit to the doctor. So when you see an exact price listed in an ad or on a billboard, just know that more than likely that may be the only starting point based on a best-case scenario. The good news is that most implant centers will provide a free, no-obligation consultation and won't charge you for your initial scans or for a treatment plan. That's certainly the case here, and if you're located in Michigan, we'd be happy to see you. Just give us a call.